As we age, our bodies go through changes. Muscle strength declines, bone density decreases, and even our cardiovascular and cognitive health can be affected. When it comes to blood pressure, the focus is usually on whether it's too high or too low. But how do we determine that? If you're over 65 and managing high blood pressure, you might already be on medication. Or perhaps you're just starting and wondering what your target numbers should be. General guidelines suggest that a healthy blood pressure for adults is around 120 over 80 millimeters of mercury, meaning the systolic pressure should be 120 or lower. Systolic blood pressure is the force your heart uses to pump blood into your vessels, while diastolic blood pressure, the second number, measures the pressure when your heart rests between beats. Ideally, this second number should be 80 millimeters of mercury or lower. But does this standard apply to older adults? Should your target change as you age? In this video, we'll discuss the new guidelines for older adults. Let's find out. Back in 2013, experts introduced new guidelines for detecting high blood pressure. At that time, a reading of 140 over 90 millimeters of mercury was considered high for younger adults, while for those over 65, the threshold was 150 over 80 millimeters of mercury. But in 2017, the American Heart Association, the American College of Cardiology, and 9 other health organizations updated the guidelines. Now, high blood pressure is defined as 130 over 80 millimeters of mercury for all adults. So if you're an older adult, it's important to pay attention to your blood pressure readings. Why? Because under the old guidelines, a systolic reading of 140 millimeters of mercury was considered normal. One of the key studies behind this change was the SPRINT study, which stands for the Systolic Blood Pressure Intervention Trial. Its results were published in 2015. This study included 9,306 people, all aged 50 or older, with an average age of 68. Each participant had a systolic blood pressure of at least 130 millimeters of mercury and at least one risk factor for cardiovascular disease. However, those with diabetes, dementia, or a history of stroke were excluded. Researchers divided the participants into 2 random groups. The first group received intensive treatment, meaning doctors used stronger medications to keep their systolic blood pressure below 120. The second group followed a more relaxed approach, aiming to stay at or below 140. After 1 year, the first group had an average systolic reading of 121.4, while the second group averaged 136.2. Throughout the study, researchers closely monitored both groups for side effects, including chronic conditions, heart issues, and deaths. After 3 years, they found that each year, only 1.65% of participants in the first group experienced severe heart problems, compared to 2.19% in the second group. However, the first group also had slightly higher medication-related side effects, such as low blood pressure, fainting, kidney failure, and electrolyte imbalances. The bottom line? Lowering blood pressure aggressively did help prevent major heart issues and reduce the risk of death, but it also led to more side effects. Now, let's look at another study published in the New England Journal of Medicine. This research examined over 8,500 Chinese adults, aged 60 to 80, with high blood pressure. Researchers divided them into 2 groups. One group followed standard treatment, aiming to keep their systolic blood pressure between 130 and 150 millimeters of mercury. The other group followed intensive treatment, targeting a lower range of 110 to 130 millimeters of mercury. After 1 year, the standard treatment group had an average systolic reading of 135 millimeters of mercury, while the intensive treatment group averaged 127 millimeters of mercury. Over the next 3 years, researchers monitored participants for major heart issues, such as stroke and heart attack. The results showed that 4.6% of the standard treatment group experienced these problems, compared to 3.5% in the intensive treatment group, indicating that stricter blood pressure control led to fewer heart complications. Both groups had similar side effects, but the intensive group experienced more cases of dangerously low blood pressure. These results match an earlier study from the United States, which found that aiming for an even lower systolic blood pressure of 120 millimeters of mercury also reduced heart problems. And here's something even more interesting. When researchers focused only on people aged 75 and older, the heart benefits were even greater. So let's get back to the question. What's the ideal blood pressure for older adults? As people age, high blood pressure becomes more common. In the past, doctors called it essential hypertension, believing higher pressure was needed to push blood to the brain as blood vessels stiffened. That's why some doctors have suggested that adults over 65 can have a systolic blood pressure as high as 150 millimeters of mercury. But now, experts see things differently. High systolic blood pressure is a major risk factor for strokes and heart attacks. In fact, the SPRINT study found that keeping systolic blood pressure at 120 millimeters of mercury can be beneficial. However, this target may not be ideal for everyone. Some older adults, especially those with conditions like diabetes or kidney disease, may do better with a target of 140 millimeters of mercury. According to the new guidelines, everyone, no matter their age, should aim for normal blood pressure, which is below 120 over 80 millimeters of mercury. But if medication causes strong side effects, aggressively lowering blood pressure may not be the best option. That's why it's so important to work closely with your doctor. Make sure they know about your health concerns, medications, and any side effects you experience. At the end of the day, your doctor's advice matters more than general guidelines. So instead of stressing over exact numbers, focus on a plan that keeps you healthy and helps you live longer. If you enjoyed this video, don't forget to subscribe to our channel, Blood Pressure Healthcare. Stay healthy, and we'll see you in the next video.